Hello, and welcome to your Microbiology Bio 203 video lecture on microbial diseases of the urinary system. I'm Mr. Kennedy, and I'll be your guide as we explore this material. First, before we get into diseases of the urinary system, we must review the basic components of this system. The urinary system is made up of 2 kidneys, 2 ureters, 1 urinary bladder, and 1 urethra. Infection of this system is often prevented by valves that prevent backflow to the kidneys, the acidity of urine, and continual and periodic mechanical flushing. This is a basic rudimentary diagram of the working parts of your urinary system. Next, we'll examine the structure and function of the reproductive system. The female reproductive system contains 2 ovaries, 2 uterine or fallopian tubes, the uterus, including the cervix, the vagina, and external genitals. This is a rudimentary diagram of the female reproductive system. Next is the male reproductive system, which is made up of 2 testes, system of ducts, which includes the epididymis, ductus vas deferens, ejaculatory duct, urethra, and accessory glands, and a penis. This is a rudimentary diagram of the male reproductive system. The normal microbiota of the urinary and reproductive systems. The urinary bladder and upper urinary tract are, for all intents and purposes, sterile. The predominant microbes of the urinary and reproductive systems can be found in places such as the vagina. Lactobacilli here produce hydrogen peroxide and lactic acid. The growth of these organisms is promoted by estrogen. Streptococci, anaerobes, and some gram-negative organisms can also inhabit this space. Candida albicans, which is a yeast organism, can also inhabit this space. The male urethra is usually sterile. Bacterial diseases of the urinary system. Urethritis, cystitis, uritis, pyelonephritis are examples of diseases of the urinary system. Urethritis is an inflammation of the urethra. Cystitis is an inflammation of the bladder. Uritis is an infection of the ureters, and pyelonephritis is inflammation of one or both kidneys. 7 million urinary tract infections occur annually, most due to E. coli. Cystitis. Cystitis is commonly caused by E. coli, also by Staphylococcus saprophyticus. Dysuria is difficult or painful urination, or pyuria are common symptoms of cystitis. 8 times or more common in women than it is in men, due to the short length of the urethra in the female anatomy. It's diagnosed with a less than 100 colony-forming unit per mil of potential pathogens and a positive leukocyte esterase LE test. It can be treated with trimethoprim. Pyelonephritis accounts for 75% of the cases which are caused by E. coli. It can cause fever and back or flank pain, generally results in bacteremia. It can form scar tissue in the kidneys and become life-threatening. It's diagnosed with a less than 10,000 colony-forming unit per mil and positive LE test, and is treated with cephalosporin. Leptospirosis is caused by Leptospira interrogens, which is a fine spiral organism that stains poorly but is an obligate aerobe. It's transmitted by skin and mucosal contact from urine, contaminated water from domestic or wild animals. It can cause headaches, muscle aches, and fever. It can lead to kidney failure and pulmonary hemorrhagic syndrome. It is diagnosed with a rapid serological test and treated with doxycycline. Bacterial species and diseases of the reproductive system. Reproductive system, when we consider diseases, is often associated with sexual transmission. Sexually transmitted diseases, also known as sexually transmitted infections, often have no signs or symptoms, but account for over 30 types of infections. There are 15 million new cases in the United States annually, and treatment is often done with antibiotics and preventatives like condoms. Gonorrhea is caused by Neisseria, a gram-negative Diplococcus organism. There are 300,000 cases of gonorrhea in the United States annually. Gonorrhea attaches to the epithelial mucosa by the fimbriae and invades the spaces between the columnar epithelial cells, causing inflammation and pus. Symptoms include painful urination, discharge, and epididymitis. In women, they have fewer symptoms, but they can also experience pelvic inflammatory disease. If left untreated, gonorrhea may disseminate and become systemic, leading to endocarditis, meningitis, and even arthritis. Ophthalmic neonatorum is a form of gonorrhea that can be transmitted to infants and cause blindness. Gonorrhea does not show adaptive immunity. There is no adaptive immunity. Antigenic variability is common. Opoproteins can bind to T cell receptors and prevent activation and immunological memory. Diagnosis with a gram stain, ELISA, or monoclonal antibodies is the best way to locate and diagnose gonorrhea. And treatment is first with cephalosporins. Nongonococcal urethritis. This is nonspecific urethritis, which includes any inflammation of the urethra not caused by gonorrhea. It can be caused by chlamydia, mycoplasma, uroplasm. It leads to painful urination, watery discharge. It's often asymptomatic, can also cause pelvic inflammatory disease in women, and diagnosis is accomplished through culture or PCR and treated with doxycycline. Pelvic inflammatory disease. Pelvic inflammatory disease is an extensive bacterial infection of the female pelvic organs. Polymicrobial infections usually involve gonorrhea or trachomatitis. This causes chronic abdominal pain. Salpingitis, which is an infection of the uterine tubes, is also common with pelvic inflammatory disease in its most serious forms. It can lead to scarring and can cause infertility or ectopic pregnancies. It can be treated with doxycycline. Syphilis. Syphilis is caused by treponema, which is a gram-negative spirochete which grows slowly in cell culture. It invades the mucosa or through skin breaks and enters the bloodstream. It induces an inflammatory response. Some strains cause yaws, which is a skin disease and is not sexually transmitted. Has a stable incidence in the United States. In syphilis primary stage, chancre sores at the site of infection occur about 3 weeks after exposure. These are often painless and highly infectious and disappear on their own after 2 weeks. In the secondary stage, the skin and mucosal rashes appear, especially on the palms and soles of the feet, due to an inflammatory response. In the latent period, there are no symptoms. In the tertiary stage, this may appear years after latency due to cell-mediated immune reactions. Gummatose syphilis causes gummas on many organs. Cardiovascular syphilis weakens the aorta, and neurosyphilis affects the central nervous system, causing dementia. Congenital syphilis causes neurological damage to the fetus. Microscopic tests can be done to identify syphilis, looking for direct fluorescent antibody tests with monoclonal antibodies. Non-treponemal serological tests can also be used. Treponemal type serological tests can be used, and syphilis can be treated with benzathine penicillin. Lymphogranuloma is caused by C. trachomatitis and affects the lymphoid tissue. This is a regional infection which attacks regional lymph nodes, who will become enlarged and tender and discharge pus and potentially scar. It's diagnosed with a blood test for antibodies for the organism and treated with doxycycline. Chancroid. This is caused by hemophilus, which is a gram-negative rod. It is associated with drug use. Painful ulcers are the most common representation of this infection. Painful ulcers on the genitals and swollen lymph nodes in the groin. There are factors. This does also factor in the sexual transmission of HIV, and it can be treated with azithromycin. Bacterial vaginosis is caused by Gardnerella. This is a pleomorphic gram-negative rod. In vaginitis, you have inflammation of the vagina due to the infection. Vaginosis is where you have no sign of inflammation. This typically causes a pH above 4.5 and a fishy odor from the vagina. Accompanying this is a copious, frothy discharge. Clue cells can be sloughed off the vaginal epithelial lining and covered with a biofilm of Gardnerella. It's treated with metronidazole. Viral diseases of the reproductive system. Genital herpes. Herpes is caused by herpes simplex virus 2, HSV2, and in the United States, 1 in 4 over the age of 30 are infected. This causes painful vesicles on the genitals, painful urination, but can heal on its own within 2 weeks. Reoccurrences from the virus's latent period in nerve cells are common. Reoccurrences can occur during menstruation, emotional stress, or illness. It can be diagnosed via culture or PCR. There is no cure, but suppression and management using acyclovir are common. Neonatal herpes is when herpes crosses the placental barrier and infects the fetus. This can damage the central nervous system, cause developmental delays, blindness, and hearing loss. It does, however, have a survival rate of 40%. Newborns infected from herpes simplex virus exposure during delivery. Diagnosis by PCR tests and fluorescent antibody tests is common. Treatment is accomplished with intravenous acyclovir. Finally, are genital warts. Genital warts, also known as condyloma, are caused by human papillomaviruses. 25% of 14 to 59-year-old women in the United States are infected. Visible warts are caused by serotypes 6 and 11. Serotypes 16 and 18 cause cervical cancer and kills 4,000 women in the United States annually. Treatment via removal of warts, podophylax, and imiquimod are common. Prevention using Gardasil and Cervarix vaccines is also common. This concludes our coverage of microbial diseases of the urinary system and reproductive system.